So my name is Aaron Derfel. I'm a journalist covering health for the Montreal Gazette.
Thank you so much. So I'm curious, what are your thoughts on the reopening, almost back to normal in terms of, the government removing the vaccine passport and eventually the mask mandate being removed?
I was always somewhat skeptical about the rush to lift these public health protections because we're still in this pandemic. And I've been watching what was going on in other jurisdictions in Denmark and in Asia, where we saw an increase in cases, an increase in hospitalizations, and then a new wave of deaths. And I couldn't understand why Quebec, and not just Quebec, but other provinces and states in the U.S. are phasing out the vaccine passport and the mask mandate. This is something that I just couldn't understand. So what we've seen since is this horrific deja vu in China. The Chinese authorities have locked down not just an entire city, but an entire province. They're once again building a field hospital in an astonishing, rate of 6 days because they're anticipating a wave of deaths. Now, the Chinese and the Asian context is a little bit different than Canada, and the Chinese vaccines have been shown not to be as effective. And there are a greater percentage of elderly people in China and in Hong Kong and even in South Korea who haven't been vaccinated. There are more elderly people in Canada who have been vaccinated. But it just underscores how this pandemic is still around us, that the virus is not quitting. I focus a lot on Denmark because this is a country with a robust healthcare system. It has 20% of the population is 65 and over. Quebec's population is also aging. It's almost 21% of the population are 65 and over. So I thought it'd be good to compare what's happening. So here you have a country in Denmark with the highest booster rate, with an aging population, with a robust healthcare system, and then they thought Omicron, the pandemic was over with Omicron. They were hit with this wave of BA2 infections that caused a spike in deaths. Now they've tried to downplay this by suggesting most of these deaths are with COVID, not from COVID. So there's someone that might have cancer, and then they get COVID, and that pushes them over the edge. So they're making that the dry distinction between that. But I think that that they're splitting hairs. Okay. So then shortly after, we're now seeing in the United Kingdom an increase in hospitalizations, not just cases. I believe there might even be an uptick in deaths. Definitely in other Western European countries, increases in hospitalizations and cases. So what does that mean for the Quebec context? BA2 is here in Quebec, and it's proliferating. It's much more contagious than Omicron, which itself is super transmissible. So we're at the stage where booster vaccination has stalled. In Quebec, it's stalled at 52%. It means there's still like 48% of the Quebec population that needs a booster, and they're not getting the booster. At the same time, you have waning immunity among those who even got the booster. So now, just slightly over half of the new hospitalizations are occurring in people who have been boosted. Doesn't mean that the vaccines are not working. It means that their effectiveness wanes over time. And we see that BA2 is proliferating, and it's perhaps the most transmissible subvariant that we have out there. Scientific American called Omicron the fastest spreading virus in human history, more so than measles. There's some debate about that, but I don't think there's any debate that BA2 is very, very contagious. At the same time, we're lifting these restrictions. This raises the question of mine, is this not a recipe for a sixth wave? Because there's a sixth wave already occurring in Europe. And so I would be very surprised if we didn't have a sixth wave. I'm thinking that we'll probably be hit with that wave sometime in April. And then how long will it last? Well, these waves typically last about a couple of months. So that would be mid-May, mid-June. And then how severe would it be? The Luc Boileau, who's the head of public health in Quebec, has suggested there's a certain degree of immunity in Quebec, and people have been vaccinated or they've had COVID, and so he doesn't seem to be as concerned, although he hasn't ruled out a potential increase in hospitalizations. If history is anything to go by, last fall we were hit with Delta. People were saying, people were really worried about Delta. When Omicron came, people were saying that we shouldn't worry as much because Omicron is more mild. But our death wave during Omicron, which was December and then this winter, is much as the second biggest death wave since the start of the pandemic. And Delta, the death wave was much lower. And this is when we were vaccinating heavily. So I don't think we're going to get I think we're going to get a sixth wave, but I don't think it's going to be as necessarily as severe as what we've had with Omicron. But I think it'll be more severe than what we had with Delta. And when we thought that this was that's going to be really worrisome when we vaccinated. But as I said, half of the population hasn't been given a booster in Quebec. And the other half that has been given a booster, half of them who end up in hospital, like half of the hospitalizations, or more than half of the new hospitalizations, are among people who have been got the booster. And then there's a certain percentage that got the second shot, one got another that got the first shot, and then there's a small percentage that didn't get vaccinated at all. So all this just underscores to me how we have to be more. We have to take precautions, because do we want to continue with the stress of this yo-yo effect of easing and then going back into lockdown, or easing and then going back into lockdown? This yo-yo effect. Why don't we follow the example of a country like New Zealand? New Zealand has its strategy is known as Vaccine Plus. So it's maintained these stringent public health precautions. So there's a vaccine mandate. There are masks, but it's also there's high vaccination. So they were hit with the BA2 wave. They were hit with that wave, which led to an increase in deaths and hospitalizations, but it was much more in check. And so we'll see how this pans out. A lot of people seem to think that, that now that there have been constant comparisons with the flu. This is a different virus. Flu pandemics last a year, 2 years. So the thinking is we're in the second year. It should be over by now. But the virus keeps mutating. Like it seems to me it's mutating a lot faster than the flu virus, which mutates a lot. And each variant is very different from the variant that preceded it. Like it hasn't grown. There's now what's being called Deltacron, which is a combination of Delta and Omicron. But the main variants of concern that have always emerged have emerged out of nowhere. The World Health Organization is saying that an expert task force has suggested that Omicron might have sprung from an animal, not in an immunocompromised patient. Could be an immunocompromised patient. So the World Health Organization has said it's not the pandemic's not over, but you have people who are fed up. They want to return to life as normal. You have politicians who are electorally minded, and they're thinking, okay, I want to get. You've had the trucker protests. People are fed up, so there's this natural desire to let's get back to normal. And to do that, let's lift the mask. But the virus is charting its own path, and it's there was for the longest time there was a denial that there was widespread. Even my experts that this was transmitted via aerosol. They thought it was just transmitted in these large air droplets that would quickly fall to the ground. Now they know, and that you don't have to spit as you talk. It's like an invisible smoke, and then these particles, these virus particles, stay suspended in the air for 15, 20 minutes. And then you breathe them in. And that's how it's been so easily transmitted. And the Chinese authorities are saying that BA2 has a quote unquote a degree of concealment. Earlier, experts had initially said that Omicron was a stealth variant because it couldn't be picked up easily, and then they found a way to pick it up. There's something about BA2. There are these Japanese researchers who said BA2 is more severe than Omicron, but their research was carried out on lab animals. It wasn't replicated. The South African researchers suggested that BA2 is not more severe than Omicron, but are the researchers accounting for the fact that South Africa's population is much younger than Denmark's? It has like 5% of their population is 65 plus. Maybe they are taking that into account. So there are some people who have urged the World Health Organization to highlight the seriousness of BA2 and give it its own Greek letter. So that's where I think we're headed. I think we're headed for another wave. I'm hoping that it won't. I'm hoping I'm wrong, first of all. But if I'm right, I'm hoping that I will continue to be right in predicting that this wave will be relatively mild. And I would urge people to get their third shot. Vaccination, I view it as a tune-up of the immune system, and no more, no less. And continue to wear a mask in public, and to avoid these large gatherings. We saw that the Canadians played their a home game at full capacity last Saturday. And lots of people were not wearing masks. Okay. So we'll see how this pans out. Where I think this kind of starts to flare up is when you have 50% prevalence in a community with BA2. We're not at 50% prevalence of BA2, but we're not screening the population, so we don't really know. And we haven't resumed wastewater testing after discontinuing it for months and months. So we're riding blind. And we're going to wait for something serious to happen. And right now, in the absence of widescreen testing and wastewater analysis, the only truly reliable indicator are the deaths. What is unusual about this is that we should be reporting 1 or 2 or 3 or 4 or 5 deaths. Yesterday, we reported 20 deaths. We shouldn't be reporting that. So what's going on? That's an indicator that this is more severe. So we'll see how this pans out. The other thing that has to be taken into consideration, and the authorities aren't, is that our healthcare systems have been pulverized. They were fragile to begin with, and they've been pulverized, being hit with a 6th wave. So it's just, once again, the annals of medicine and pandemics are replete with, histories of authorities, the population getting fed up and going back to what they think will be normal, and then being blindsided by another wave before the virus becomes endemic. And then you have states like Florida where they've had a huge death rate. They've suppressed the data, and it's a free-for-all in Florida. And it's almost as if, what can we as a society accept? Can we just accept a certain amount of death? We'll go about what we do and we'll accept a certain amount of death. And then I guess finally is what authorities are not really understanding is the effect of long COVID, the long-term effect of COVID-19. This virus has been shown to literally shrink a person's brain. It's been shown to place people at great risk of diabetes. It's been shown to cause cardiovascular disease. In some ways, it's not really a respiratory virus; it's more of a vascular virus. So that's where we're at, and the impact, the fallout from this pandemic will be felt for another 10 years. But we know this because McGill University researchers they carried out a study on what they predict will be an increased rate of mortality in cancer patients who were not screened during the pandemic. And that they're saying that they're going to have these increase, like in Quebec, they're saying if it's 2,600, 2,300 more cancer deaths until the year 2030. But that study was taken a year and a half ago, before the latest Omicron wave, when we resumed the délestage or putting off things. So I would imagine, this is what I mean, like in terms of long COVID, increased cancer mortality, maybe increased cardiovascular disease, indirectly as a result of COVID, the impact to our healthcare system. Even once this pandemic is well and done, there will be that follow. So I'm going to spend the rest of my career until retirement writing about the fallout of the pandemic. But I don't think we have escaped that acute phase. Our politicians might want to tell us that we escaped the acute phase of the pandemic, but just look to what's going on in Hong Kong, South Korea, China, Austria, Finland, United Kingdom, Germany. So start getting an idea that this pandemic is not over, okay? And why would we be spared? This is not just my opinion, too, right? I mean, it's the informed opinion of people who study this, experts in epidemiology who study this. So that's basically where we're at. It's an unfortunate situation. People are very, very frustrated. Mm-hmm. On the other hand, there's a war going on in Ukraine. That war is going to prolong the pandemic. You've seen more than 1.5 million or 2 million refugees who are fanning out from across Europe. There was low vaccination, and war creates conditions, displacement and close quarters creates conditions for this was what happened during 1918 during the so-called Spanish flu pandemic. It was prolonged because of World War I, and they both exacerbated each other. So I see this still playing itself out, mm-hmm. and then will we have to get a vaccine every year, and in the sense that it'll become like a flu virus that for which we need to get a vaccine every year, and we'll have to get a flu shot and a COVID shot, or it will be like we have the MMR vaccine for children, the mumps, measles, rubella vaccine. Will it be a vaccine that contains that guards against both the flu and COVID? That's something, or will they be separate? Or these are still plenty of unanswered questions. Anyone who was able to tell you with any kind of certainty, this is how it will go, doesn't know what they're talking about, because everyone doesn't know what's happening with this. It's completely new, And my whole approach throughout this has been to use the precautionary principle. When you don't know, when in doubt, facing a very serious healthcare problem, it's better to be safe than sorry, and it's better to be accused after the fact that you're maybe a little bit, you're exaggerating a little bit, and you're a little bit too precautious, but things are in check. Then for there to be to adopt a laissez-faire approach.
Mm-hmm, mm-hmm. Thank you. I just have a couple more questions, if that's okay. I wanted to ask, the government's decision to reopen, aside from the population being fed up, do you think that this is to serve, capitalist and economic interests almost over the good of people?
Our economy does need to survive. People need their jobs, so the people are under great pressure to reopen. Restaurants have been demanding that they be allowed to reopen. There are jobs at stakes, and this is where the politicians are being lobbied by these different industry groups, and this is sometimes where they've ceded to them instead of listening to the public health science. And again, the annals of medicine show pandemics where this has happened, because following the lobbying of merchants, a society reopened, and only to once again be hit by another wave. So I think Quebec, in Quebec, Premier Legault sometimes has perhaps been unduly influenced by the business sector. He himself comes from a business background, he's not unique in that regard. I think all politicians are guilty of that to some extent. Some even worse, like Ron DeSantis, the governor of Florida. So yes, I would say that sometimes our politicians have been unduly influenced by business lobby groups, and as a result have reopened quickly or adopted too many half measures, and so the pandemic persists. had the world all taken the approach that New Zealand took, and New Zealand is a comfortable position because it's not a nation, but had the whole world done what New Zealand did, I don't think we'd be in this pandemic today. But it's escaped, it's out there, and it's mutating.
Mm-hmm. Thank you so much. And lastly, I just want to ask, especially keeping in mind your vast reporting on long-term care homes and hospitals throughout the pandemic, I guess, what are maybe some of the industries you might note as having their workers, most affected, maybe most on the front lines of?
It would have to be healthcare workers. It would have to be them first and foremost, and then we've seen often meat packing plants where workers are working in close proximity with each other, where ventilation might sometimes be an issue. You think that then the meat packing plant ventilation would not be an issue, but you've seen it in meat packing plants. You've seen it in bars. Those are other industries, but definitely it starts with healthcare workers, and we can't ignore to schools. Schools are a vector for the transmission, and then people's homes. It's everywhere. But there's no doubt that it's the healthcare workers who have suffered the most, the brunt of it, and that includes employees in long-term care as well, where you have a lot of deaths. That's where there are a lot of deaths. But what was very, very interesting, Savanna, what was very, very interesting is during this last wave, the Omicron wave, the government knew it was coming. In anticipation, it really pushed vaccination, which was good. Boosters in long-term care. But it didn't push vaccination among the elderly living at home. And the death wave, this has been a blind spot. I really reported this, and it's almost unconscionable. Government knew Omicron was coming. It carried out massive vaccination of boosters in long-term care. Why didn't it do that among the elderly at home? Most of the deaths, vast majority of the deaths that have occurred in the first wave were people who had been living at home. And what would happen is, they get sick, they go to hospital, and they die in hospital, but the death is declared as having originated from the home, as opposed to long-term care where they receive some care, but they're living there too, in essentially what's like a kind of hospital, right? A nursing home. So that's really to me, it's saying something. So again, like in this sixth wave that will crop up, you're going to see, as you're seeing in China right now and in Hong Kong, it's elderly who are dying. You see more elderly people in their 70s and 80s, and that's tragic. These are people who got vaccinated, did everything, and only to die 2 years later. It's like some horrible zombie movie. Where you just think you've reached the end of the movie, you've almost reached the end of it, and then your hero dies. And that's what I'm worried about, and that's why I've been producing these threads, writing these things to verify, to keep the government accountable, to verify assertions by the government, fact check the government, and also sometimes to draw the government's attention to best practices and to warn against bad practices, in the hope that this will raise awareness and to improve the situation for all Quebecers.
Mm-hmm, mm-hmm. Thank you so much. And I just wanted to add one last thing, based on what you said, just about, in particular, of course, healthcare workers, but meat packing workers, people in bars. Is there anything you think that if the government won't do, can the employers, enforce anything or do anything to ensure the safety of their workers?
I think healthcare workers, they are doing some of that, but there are, so wearing N95 masks, it depends. There are some, it's up to the discretion of the employer. But we're now, what I deplore is we're at this state where this perception has taken hold that the pandemic is over. I would be more comfortable if the following happened. If for a 4-month period, okay, we had continuing declining hospitalizations and no evidence of any kind of resurgence. For me, for the coast to be clear, we need 4 months. But we're in mid-March. Go back the last 4 months, right? Mid-February, mid-January, mid-December, mid-October. We need 4 months, but the government seems to be just focused on 1 month or 2 months. They're not focused on 4 months of time. And what we should do is we should rebrand these restrictions as public health protections or precautions or measures. That's number one. And we have to change people's expectations in terms of thinking of time horizons of 4 months. Think in periods of 4 months. Think in periods of not quarters, but trimesters. They have to think like, let's wait to see what happens. We're going to have these for another 3 months. Now, the government during this time last year, it kept the curfew on for 6 months. Okay, but that led to the situation really being stabilized in Quebec. I'm not saying that we have to return to the curfew, but they kept more restrictions for longer. Ultimately, if you continue playing like this, you're going to hurt the economy. In China, there are right now in its like tech sector, some of the plants have suspended production. This could cause a repercussion for the economy if this continues. Ultimately, paradoxically, the desire to reopen for the economy's sake ends up hurting the economy more in the long term. But what you're talking about business people, not epidemiologists or virologists, and these business people are thinking of their quarterly profits, and they're not thinking of the long term, right? And that's where you get that inherent conflict.
Thank you so much. This has been tremendously helpful, and it's always a pleasure learning from you. So thank you so much for making it.